Pedo. Yes, pediatric dentistry. That's what we're going to be talking about today. How to successfully match into pediatrics and the journey behind it. Today, we're joined with, Dr. Kalin, who's going to share with us his journey. We're going to be talking about why he selected pedo, how he prepared for his applications, the schools, how did he come up with his list, and the interviews, how many interviews, the interview day, what to expect. And we're also going to be talking about how he formulated his rank list. And then he's going to share some details about the program that he matched at. And also, he's going to share some insights, tips, and advice for those of you that are applying to pedo, looking to become a board certified pediatric dentist. So be sure to stay all the way through to today's episode. Also, today's episode is being brought to you by Get Into Dental Residency Challenge. Yes, a challenge. Get Into Dental Residency Challenge, which is the ultimate resource to help you jumpstart your application and your candidacy for residency. For more details, check out the link down below and go to getintodentalresidencychallenge.com. All right. Today, we're going to kick it off. Doc, introduce yourself for some of us who are meeting you for the first time, and just give us some background information.
Yeah, my name is Dr. Kalin. I'm from Dallas, Texas originally, moved to Houston for dental school, and I graduated in 2022. So I've been working now primarily in more of a general dental setting, focusing on pediatric patients, and that's how I grew my love into pediatric dentistry. And I moved to South Texas for a year and a half, and that was a phenomenal experience for me, moving to more of a rural, underserved area and working in an environment similar to pediatric dental residency, actually. And now I'm back in Houston working in a similar population as well. So I'm really excited that, I started this journey of becoming a pediatric dentist, and I'm excited for the things to come.
And we're going to talk a little bit more about those things that are coming in the next couple of months when you start pedo. But why pedo? There's different specialties, right? And some of them are connected. There's an ortho pedo connection. And there used to be at least one or two programs where it was an ortho pedo program out there at UCLA. But that's another discussion for another day. Today, we want to learn why you pick pedo. What about pedo that just made it a thing where you decided, hey, this is what I'm going to be doing or want to do for the next 30 years of my career?
That's a great question. In dental school, we didn't have a whole lot of pediatric dental experience, so that was never really something that I was looking forward to. When I was really shadowing before dental school, I saw a lot of implants and surgical extractions and all of that gnarly, gruesome surgery dentistry, which really caught my attention. But one thing that was really life-changing through my dental career was getting the opportunity to move to South Texas, because I was working in a office where they really focus on a lot of CE courses. And it was an office that really did see a lot of pediatric patients and adolescent patients. So I really wanted to go into that opportunity environment to learn a lot of molar endo, OSCE, Pros CE. But one thing that just caught my eye, just working with so many pediatric patients and shadowing the pediatric dentists, that's really how I realized this is what I really want to do. This is my passion. And once I made that decision and commitment that this is something that I really see myself doing for the next 30, 40 years, I'm going to put my 110% effort into pedo.
And everyone will have a different journey, right? You'll have a different journey to the specialty or to the things that you want to focus on. So one quick tip, as you are continuing to explore things within the profession and also through different specialty, make sure that you are taking notes. Keep a journal. Document those experiences, not only for your future application, but also so that it'll help you remember what things that you've liked in your experiences of the different specialties that you're exploring, what things stand out so that you remember, because it could be a lot of different things. Now, what do you remember about your application? Meaning, what was the strategy that you were thinking of as you were developing and preparing your application? Share with us how you went about doing that for you putting your application together for pedo.
Yeah, so this was the first time I was ever applying for residency at all. So just like many people who are watching, didn't really have a sense of direction or understanding of what to expect for the process. And so one of the things that really helped me during this process was really reaching out to you, Dr. Darwin, early on. I want to say maybe we talked October or November 2023. Keep in mind, applications opened May 2024. So this is 6, 7 months before applications even opened because I really didn't know how to get started with this process or what to expect. So that was really critical for me because what I did in those 6, 7 months leading up to applications was reaching out to program directors, program coordinators to really set up externships. That was something that really along the way. And then a few months before, I think it was like we started maybe February, March, and April, we were focusing together on the personal statement and we finished maybe 80, 90% of the CV as well. So that really helped because I look like you don't really realize and understand the importance of starting early until the very end of the whole journey. But for me, applications never like applying to pediatric dentistry didn't start when applications opened in May. It started when we first got that phone call, when I knew 110% I'm going to focus on trying to get into pedo residency. And my goal, honestly, wasn't to get into pedo residency. My goal was to have the best possible application that I possibly could send to the different programs and see if I would be a good candidate to be a pediatric dentist. And since I didn't know what to expect, I didn't care if it took me 1 time, 3 times, 5 times. I knew this is what I wanted to do. So my goal was to really provide the best application I possibly could. And so starting early is definitely the key for me.
Now that's interesting because I didn't remember that. In our discussions prior, 6 months and up to when the Adia Pass application was open in May, I did I forgot that your real goal was, more intentionally about I'm going to put together and submit the best application possible versus I want to get into pedo and I know that I'm going to get in because of my application. You took the lesser of the big jump, right? As far as trying to sound like maybe trying to curb your expectations. That sound about right?
Well, everyone told me around me that getting into pediatric dentistry is competitive. And I am the type of person that, I tell myself, if I want to do something, I'm going to put my 110% effort in. And regardless of the outcome, I didn't want that, put all my eggs in one basket, say, I'm definitely getting in this cycle. And then, next cycle kind of be not as motivated. I didn't want that to happen. So for me, obviously, I wanted to get in my first try, but I also knew that sometimes you can control what you can control. And that's what I wanted to focus on. I wanted to focus on, how can I be the best version of me? And that's not just with applying to pediatric dentistry, but also working as a general dentist too, each and every day, taking time to reflect and see how can I be the best version of myself? And everything else is going to fall into place after that.
Yeah. Okay, that makes sense. I just want people to also understand this, which is all of these specialty programs are competitive, just like dental school, right? So that is a bottom line foundational thing that you're going to know about each and every specialty for residency. They are all very competitive. Now that you know that, you don't have to worry about it. You just apply, right? And like you said, applying also means putting forth your best self, right? Your best authentic self for this application cycle because you can't be thinking about the next application cycle when the one that you're in hasn't even started or you haven't completed that one. So focus on the now, right? Tomorrow comes today, but you focusing on now, which means this application cycle. So thanks for sharing that. I not recall that from our conversations. I forgot. I guess we were so busy getting everything together with your application. It was we were just focused on that. Guys, hope this has been helpful. And we just talked about how to become a pediatric dentist and how to match and the journey that it takes to get to that end point. Doc, so happy we had the opportunity to work together and not only launch you and jumpstart your candidacy, but also solidify it by matching. So congratulations to you, man, again. And so great to have this final result and you being able to get to your future desired state. Now you can see it, right? You can see it and feel it.
Exactly.
And feel it.
Thank you so much, Dr. Darwin. I know we worked together for this whole journey, and it was an amazing journey, and you pushed me hard, and that's what I really wanted and needed. So, didn't have to go through this process again. So I'm really excited that we did this together, and thank you so much.
Hey, well, thank you for allowing me to be your accountability partner and kind of work with you and push you, like you said, but also another reason why it's important to have community, right? To stay connected, to ask for help, but also go through a process in life, in this particular case, a professional development opportunity process with others, right? Because you can do it by yourself, but why when there's others and people that are out here that can help you along your journey, right?
And you were a former program director, so you kind of know what to look for and what other program directors are looking for in your application too, or interviews too. So that really helps also. So that was definitely something that I'm super excited that we went through this process together. So thank you so much.
You're welcome. And for those of you listening, watching, I'm going to say thank you in advance for going to the next video. Go to the next episode. Go to the next episode right now. Go, go, go.